Forensic settings, confrontation isn't something that's inevitable. It's often something that happens a lot for people working in forensic settings, psychologists, therapists. Often we need to be able to address unsafe or harmful behaviour directly. My name is Dr Kelly Watkins. I'm a forensic psychologist, and I'm going to be looking at how we can use compassionate confrontation within forensic settings. Because there is a challenge. How do you confront behaviour without escalating the conflict, without damaging trust or compromising safety? So I want to explain how this works and how you can effectively use compassionate confrontation, because it's a skill and it's about addressing behaviour clearly and assertively whilst maintaining empathy and respect. And within forensic settings, it is essential because many of the individuals that we work with have histories of trauma. Potentially they may have behaved aggressively at some point, and they may even have some problematic personality traits. And staff within these settings need to be able to maintain safety and boundaries. And trust and rapport are absolutely essential for rehabilitation. And it's not about being soft or avoiding issues, it's about being honest and being humane. So it's about assertiveness plus compassion equals compassionate confrontation. When confrontation is done poorly, it can escalate aggression, violence, increase non-compliance, and even damage the therapeutic relationship. Conversely, when things are done compassionately, that people may be more likely to reflect on their behaviour, staff can maintain safety without the fear of conflict, and interventions can be more effective, and the rehabilitation outcomes obviously improve. It's a balance of structure and empathy, which exactly what is taught with kind of staff training and therapeutic programs. But with this not having much confrontation or being able to manage confrontation, that often leads to escalation. So there are two different frameworks that I like to use. So first we've got the SAFE framework. So it's simple, memorable with an acronym. It can be applied across clinical, custodial, therapeutic settings. The second framework doesn't have an acronym, but it can also be applied across those settings. So with the SAFE framework, so the S stands for staying calm. So what you want to do is regulate your own emotions first, thinking about your tone and your body language, that they often can communicate way more than words could. So being able to regulate yourself before you go into a situation is key. Assess the behaviour, so that's A. So identify the behaviour that you're trying to address, its context, any potential triggers, and ask yourself, like, is this unsafe? Is this repetitive? How severe is it? So really being able to analyse that behaviour. The F is focusing on the behaviour, not the person. So using objective language, avoiding labels or criticisms of the individual, of their personality. So describing the behaviour, so what was observed and its impact. Then with the E, it's about expressing empathy and maintaining boundaries. So showing understanding, saying, oh, I can see why you might be feeling frustrated, but having that clear limit. So however, hitting is not acceptable. So that is the SAFE framework. Another method that I use, it follows a couple of steps. So first is preparation. So having that self-reflection before the confrontation or the conversation, before confronting. So taking a moment to reflect. So what is the issue? So what's the issue that you need to raise? What impact is it having, whether that's on their order, on their sentence, on the safety of others, on the professional relationships? What assumptions am I making? So as a professional, are there any assumptions that you're making about the behaviour? How do I want them to feel during this conversation? And usefully, am I emotionally ready to have this conversation professionally and calmly? And that kind of ensures that you respond, not react, and obviously bring the right tone into the room. Then having the confrontation. So there are a couple of steps. So step one is start with the intentions and the ground rules. So for example, I need to talk to you about something important. So the purpose is to help you to progress, not catch you out. So this lowers the defensiveness and reminds them of maybe that shared goal. So thinking about progress and not punishment. And step two is naming that specific behaviour. So being factual, neutral and direct. So maybe saying, oh, in your last session I noticed that you became defensive when we discussed X, Y and Z. But avoiding generalisations and stick to clear and use those I statements and the observable information that you have. Step 3 is expressing the impact and responsibility. So talking about, well, when this happens, it affects our ability maybe to communicate, it limits how we can support you, focusing on the consequences, not threats, and explain why the behaviour matters to their process, to their goals, or like to the community safety. Step 4 is inviting reflection or context using curiosity. So asking, well, what was going on for you in that moment or in that day, and maybe can you help me understand what led up to that decision, or like how do you think that came across to others? And this supports that motivation to change by promoting that insight into their own behaviour in their own situation. Step 5 is to re-establish expectations and next steps, so offering support but don't avoid the consequences. So then being able to continue a conversation if it's needed. Then after that is a follow-up. So this is about maintaining accountability and trust. So after the conversation, ask yourself, did I model respect and authority without being aggressive? Did they seem to understand the issue or the seriousness of it? Did we agree on a clear next step or a support plan? Should I check in with them again next session to see how things have changed? And following up shows that you're consistent, reliable, and also fair. So with this, that there are some other tips that could be useful when you're thinking about practicing compassionate confrontation. Rehearsing your language, so focusing how you can address someone's behaviour and not their character. Keeping your tone neutral and body language open but firm. Invite that dialogue. It shouldn't be a monologue. It's about asking perspectives, being able to perspective take and being able to hear each other's side. Using reflective listening to show understanding, so the active listening. And then having that debrief afterwards. So as staff, that supervision is key for your learning and also for your emotional safety. So I think that compassionate confrontation can be a really core skill within forensic settings, forensic psychology, because it helps to manage the challenging behaviour but maintain trust and ultimately supports rehabilitation. And when it's done well, it can hold people accountable and treat them with dignity. So thank you so much for watching. As always, if you like this video, please give it a thumbs up and subscribe to see similar content like this. And if there's anything that you'd like me to see cover in a future video, please drop that in the comments. Thank you, and I'll see you next time.